Good morning and welcome. Today we got another episode of Fertility Talk, and we're talking to Dr. Skye de Jongh, and she's from Vitalab KZN. And today we're talking about getting fit for pregnancy. So thank you very much, Dr. de Jongh, for joining us this morning.
Thanks, Leanne. It's always a pleasure to be here.
Okay, can you please introduce yourself?
Sure. My name is Dr. Skye. I am one of three doctors at Vitalab KZN in Umhlanga, and I am really excited to talk to you about prepping for pregnancy today because I think a lot of people think, okay, I'll just stop my pill and I'll get pregnant immediately. And that's for some people, that's how it works. But for a lot of people, that's not how it works. And so I think being prepared goes a long way.
Okay, perfect. Thank you very much, Dr. De Jong. So our first question is, how soon before trying to conceive should one start a family-focused fitness and wellness plan?
So it's not a simple answer. I think that answer is different for everybody. And I think it depends on your age. A lot of it depends on your age. And I think what's important is to understand how your body works and what your expectations of pregnancy are. So when you are trying to conceive, if you're under the age of 35, 1 out of 4 eggs is going to be normal. That means that 1 out of 4 months, do you have a realistic chance of falling pregnant? Okay. So you could get lucky and fall pregnant the first month, but you could also get unlucky and fall pregnant the fourth month.
Yeah.
Okay. This is provided that you're healthy and everything else is working fine. If you're over 35, then between 35 and 37, only 1 out of 5 eggs is normal. So it's going to take closer to 5 months. If you are 37 to 39, only 1 out of 7 eggs is normal. So 1 out of 7 months do you have a chance. If you're 40, only 1 out of 10 eggs is normal. So it could take 10 months. And if you're 44, only 1 out of 20 to 40 eggs is normal. So it could take you 2 years. So I think you need to have a realistic expectation of how long it's going to take and how hard it's going to be to get pregnant. And so that's going to go into your planning. I think it's also really important to understand what you're getting into. So what does being pregnant mean? It means that you can't travel to a malaria area. Over 32 weeks, you can't fly. You're not going to be drinking, so you're going to want to plan these things because if you've got a wedding or a big business trip coming up, you've got to plan these things. So pregnancy is not something that you ideally just do on a whim. So I'd say that you need at least 3 months sort of preparation before you get pregnant, and that's just in general. But you've got to start thinking about these things way before. So you're preparing your mind, I think, is really important, and preparing your mind to know that it might not be as easy as getting pregnant next month. So that's the first thing. The second thing is also understanding your cycle. So yes, people get pregnant with oopsies, but if you are really wanting to get pregnant, then I think it's important to understand that you have a fertile window every month, and everybody's fertile window is different. So that's not to say that everybody ovulates on day 14. You'll only ovulate on day 14 if you have a 28-day cycle. So the second half of your cycle is the half that is, or the bit that is static. So you will always get your period 14 days after you ovulate. So if you have a 28-day cycle, you ovulate on day 14. But if you have a 32-day cycle, then you're going to ovulate on day 18. Okay, so you need to start tracking your cycle before you want to start falling pregnant so that you know when that window is. And that window is about 6 days. So sperm can live in your vaginal tract or your uterine tract for 5 days. So from 5 days before ovulation and then 36 hours after ovulation, because that's how long the egg is around, that's your fertile window. So if you're ovulating on day 14, then you're fertile from day 9 to day 15 and a half. If you're ovulating on day 18, then you're fertile from day 13 to day 19 and a half. So everybody's different. So tracking your cycle from 3 months before you want to start trying will give you that insight so that you know when you want to start sort of trying. And I'm not saying you have to be so sort of pedantic, oh, you have to have intercourse at this time, but just understanding how it works so that you don't end up sitting in a doctor's office saying, oh, I don't know why I'm not pregnant, but you haven't been having intercourse at the right time. So all these things I think go into preparing you to start trying. Yeah.
Okay, perfect. Thank you, doctor. Our next question is, what role does body weight, BMI, play in fertility? And how can one achieve an optimal weight for conception?
So BMI stands for body mass index, and it is a calculation of weight over height squared. And it gives us an indication of your general health. It's not the be all and end all. Yes, if you are a very muscular person who's on the shorter side, your BMI is not going to be a great indicator. But for most people, it is a good indicator of fat percentage and health. And so a BMI of under 30 is associated with a higher chance of getting pregnant, and it's associated with a lower risk of miscarriage. Ideally, we'd like your BMI between 18 and 25, but over 30 is where we start seeing infertility rearing its head. And then over 35 is where we really start seeing high chances that you've got a 4 times higher chance of being infertile if your BMI is over 35, and your miscarriage rate is double. So it does have a huge impact. And this is for men and for women. So obesity in men does play a role in sperm quality. And obesity in women tends to lead to menstrual irregularities. So you'll find that your period can get irregular, it can be quite heavy, you might not ovulate regularly, and this is due to higher levels of estrogen in your excess adipose or fatty tissue. And so weight loss and trying to get your BMI less than 30 can improve all of these factors. Obviously, the first steps would be to look at your diet. We'll talk about that more, and then an exercise, which we'll also elaborate on. But if those things are failing you, then we can also look at pharmacological options like Ozempic or Saxenda, one of those injectables that can help you to lose weight quite quickly and safely.
Thank you very much. I'm glad you mentioned about obesity in men as well, that it does affect. And I'm just thinking that is actually a good topic. We should definitely delve more deeper into that with the next talk we have. So our next question is, what are the best nutritional guidelines for someone trying to get fit for pregnancy?
So we work very closely with dietitians, and they would probably be better set to answer that question. But in general, the evidence has shown that making sure that you get enough omega-3 in your diet, as well as antioxidants. So omega-3s you're going to be getting from your salmon, from your chia seeds, from your nuts, from your avocado, then antioxidants from berries and fruit and veg. And then you want to be eating low GI foods and decreasing your trans fatty acids. So you want to be avoiding your complex carbohydrates and trying to eat as naturally as possible whilst controlling your portion size. There are different diets that are specific for patients with polycystic ovarian syndrome with versus endometriosis. So those you could go into more detail with your dietitian. So if your BMI is elevated, I definitely would advise seeking help prior to trying to get pregnant so that you don't run into these issues when you are trying.
Okay, perfect. Next question is, how does overall physical fitness impact fertility for both men and women?
So so exercise is really important. There have been quite a lot of studies done on this, and they have found that exercise will improve Obviously, it'll help with keeping your weight normal, which helps to regulate your cycle and make sure that you're ovulating. It also helps to improve mood by increasing endorphins, and it also helps with libido. You know, if you're feeling good about yourself, then you're more likely to feel in the mood. And when you're trying to conceive, it can become quite laborious quite quickly, and so you want to try and keep things interesting and enjoyable if you can. So definitely, there's a role of exercise from that perspective.
Okay, perfect. Thank you. The next question is, are there specific exercises or fitness routines that can boost reproductive health?
Yes, there've been quite a few studies, mainly around polycystic ovarian syndrome, and they found that so the general guidance is that you should be doing either 75 minutes of vigorous exercise per week or 150 minutes of moderate exercise per week. So we're talking about running, jumping, digging. Digging, I'm not sure who does digging for exercise, but you know, if you're a gardener, that's your vigorous, and then your
Yeah.
moderate would be more your swimming and your
Walking.
Pilates and that kind of stuff. So you want to either do a short amount of vigorous or a little bit more of the moderate. But a recent study showed that in polycystic ovaries, they found that the vigorous exercise actually had better outcomes. It was better at regulating your period, superior at weight loss, and superior at getting people to ovulate. So putting in less hours but more intensity seems to be a better way of going about it.
Okay, perfect. Our next question is, how does stress management and mental health contribute to fertility and a healthy pregnancy?
This is difficult to quantify.
Mm.
So, you know, doing studies on stress, everybody reacts differently to stress. You can't quantify it and you can't control all the variables. But
Mm.
certainly, we do see that stress does affect your hormones. So your body recognizes that you're in a sort of fight or flight mode, and it can stop ovulation. You know, it says this chick is not ready for the responsibility of a pregnancy, and it just stops your FSH and LH. And so you'll often find your period is delayed if if you have
Mm.
a loss in the family or something like that. So definitely trying to decrease your stress can help to regulate your hormones. But having said that, you know, we do find that people can conceive in stressful environments, and I think it's a very individual thing. But definitely trying to decrease your stress, I think, will help with your ability to conceive. Just making sure that you're in a good space. If your body thinks you've been chased by a lion, then it's unlikely to allow you to
Mm.
conceive. But yeah, I recognize that, you know, a lot of us are working and we do live in stressful environments, and there's never a perfect time to have
Yeah.
a baby. No one's going to just stop working to have a baby. So um, I think you need to be realistic with that, and not put it off for too long. Because I often see
Mm.
that with patients is they say, oh, you know, my job is too stressful, I can't do it. And then they end up in my office at 42 and their egg quality is so bad that they need donor eggs. So I think you've got to find a balance. You've got to find a way to be to try and decrease your stress, but in a way that's manageable, where you can still do your job, you know.
Yeah.
Yeah, but mental health definitely plays a role. If you're depressed or you're very anxious, you're unlikely to have good libido and a healthy relationship, you know. So I do think that getting that under control prior to wanting to get pregnant is also a good thing, because it can be stressful if you don't fall pregnant straight away.
Yeah.
So starting off on the back foot, I don't think is a good idea.
Thank you. Our next question is, are there any lifestyle habits such as sleep or hydration that significantly affects fertility?
There is evidence to show that shift workers struggle to conceive compared to patients who work a regular sort of 9 to 5. So if your sleep is disrupted, it can affect your hormone balance and regular ovulation. So yes, sleep is important. So I would try and prioritize regular sleep. It's not to say that you can't fall pregnant if you're a shift worker, but it might be trickier. In terms of hydration, there's no evidence that I know of that says that drinking more water will make you more fertile.
Mm.
But yeah, I think that staying hydrated is good in general, but I don't know of any firm evidence that says that's going to help.
Okay, perfect. Our last question is, are there any blood tests or investigations needed?
Yes. So I think that if you're healthy, you're having regular periods, then coming to see a gynae about 3 months before you want to conceive is a good idea, just so that you can make sure you've got a recent pap smear. We can do the bloods. We can check that you're immune to germ and measles. Make sure you don't need a booster vaccine. We can check that your iron levels aren't low. We can check your vitamin D levels. We can check your STDs. And we can just optimize all those things prior to you getting started, so we don't have to fix them later when you're pregnant, you know. So generally, it'll take about 3 months to boost iron levels if they're low. That vaccine I spoke about, the rubella vaccine, can't be given when you're trying to conceive because there's a theoretical risk that you could get rubella from the vaccine. And if you get it when you're pregnant, you can have a child who's mentally disabled. So you need that time beforehand to do that. So these are some of the things that can sort of be optimized beforehand. Also picking up if you've got a thyroid problem, fixing that can also help. And then you want to start your supplements at that point. So ideally you want 3 months of folate in your system prior to starting to conceive. That'll decrease your chance of a neural tube defect, so that's a spinal issue in your baby. It'll also decrease your miscarriage rate and increase your chance of conception. You don't need to be taking a full-on pregnancy vitamin at that point unless you have a deficiency in one of the vitamins. Usually it's just folate for the first trimester, and thereafter do you require additional supplementation. If you have PCOS, it's a good idea for you to be on inositol for those 3 months prior to wanting to conceive, just to try and bring your insulin levels down and try and get you ovulating nicely. So yeah, seeing your gynae to do those bloods, do a scan, check everything's looking good, you don't have any polyps in your uterus, that kind of thing. You definitely don't need to sort of wash out your contraceptive. That's a common misconception. People think, oh, I better be off the pill for 6 months before I start trying to conceive. That's not the truth. The pill will be out of your system within 48 hours. So that's not necessary. And often if you have polycystic ovaries or endometriosis, you're actually most fertile in the first 3 months after stopping your pill. So I think coming to see your gynae for that, to get that information, is really helpful, because otherwise,
Mm.
if you stop it way before, you're going to miss that most fertile period.
Yeah.
Same with the IUD. As soon as you remove it, you are fertile. There shouldn't be a washout period at all. The only ones that do have a delay are the injectables and the Implanon. So the injectables will stay in your system for up to 18 months in some
Wow.
people. So you might not see your period for 18 months after stopping an injectable, especially if you've been taking it for some time.
Yeah.
So I would recommend probably stopping that a year before you want to get pregnant, so that you're not disappointed from that perspective.
Okay, thank you very much, Dr. De Jong. I really appreciate talking to you this morning and you taking time out to do this talk. And we hopefully see you again soon.
Thanks, Leanne.
Thank you.
Cheers.
Dr. Skye de Jongh is available to, if you want to get hold of her, she's at Vitalab KZN, or Vitalab, sorry, Vitalab KZN. And you can email her, Doctor, if you just want to give your email address.
My email is skyed for De Jong at vitalabkzn.com.
Okay, perfect. Or you can visit the vitalab.com website. You can find the details on there, or you can visit them on the Fertility Solutions website. So thank you very much, Doctor, for this time this morning. Thank you.
Perfect. Thanks, Leanne. See you
Bye.
soon.
Bye.
Bye.